Dozens of people arrested, tens of millions of dollars stolen, say federal agents, through bogus Medicare claims. It's all part of a sweeping roundup today in 3 states. Our senior correspondent, Alan Chernoff, is joining us now from New York with more on this. This is a big crackdown. How did it come about, Alan?
Wolf, it actually happened as a result of data mining. The feds have been looking at the claims submitted into the government, and that's how they are pinpointing the fraud. Today, federal agents broke up 5 separate rings that allegedly filed $61 million in false claims to the Medicare. 32 people are charged in Miami, Detroit, and Brooklyn, New York, with a variety of schemes. The largest case in Miami involved a doctor and nurses who allegedly ordered home health care services that were not medically necessary. In Brooklyn, a company called Medicare and Home rented space from this realtor. Its owner and head of customer service are charged with billing Medicare for expensive, custom-made orthotics for diabetic patients, when in fact, the company was merely providing inexpensive, off-the-shelf inserts, in some cases when they weren't even medically necessary.
When someone sends fraudulent bills to Medicare, they are stealing American taxpayer dollars that are intended for those most in need.
As we've reported, healthcare fraud is a multi-billion-dollar enterprise that has spread to organized crime groups. The Departments of Justice and Health and Human Services say they're expanding their joint healthcare strike force teams into Brooklyn, Baton Rouge, and Tampa to complement the 4 teams already in place. Those cities are targeted because a Health and Human Services Inspector General analysis finds fraud is widespread in those 7 areas.
There are people who are masquerading as healthcare providers, who have no business claiming to be healthcare providers. And that also constitutes a significant part of the fraudulent action that we're uncovering.
Miami is ground zero for healthcare fraud. The Inspector General found 52% of all Medicare home health care expenses above $100,000, those are supplemental payments, were in Miami-Dade County. Yet only 2% of Medicare home health care beneficiaries actually live in that county. Wolf, a very clear sign of Medicare fraud in Miami.
So are we likely to see more of these arrests, more charges of this fraud coming down the road?
Well, Wolf, unfortunately, there is so much of this fraud. There's no question that we are going to see more, especially as Health and Human Services and the Department of Justice expand their strike forces. They like to say that they are zeroing in on the fraudsters and using computer technology, mining the data to find the fraud.
And this is money being stolen from American taxpayers when all is said and done. Alan, thank you. Let's go to